Hello, this is Kevin Russell. I'm speaking today about social insurance compared to public assistance. This presentation has been prepared for the California Department of Insurance in connection with Oliver Wyman's work assisting the CDI with the Long-Term Care Insurance Task Force meeting number 3. Moving to slide 2. This slide has the qualifications, assumptions, and limiting conditions for this presentation. And now on to slide 3. Here's what we're asking of our long-term care task force members. Please read this document or watch the YouTube presentation recording. Number 2, respond to our brief questionnaire regarding your preliminary recommendations for the program design elements discussed in this presentation. Third, review the summarized questionnaire results prior to the upcoming task force meeting. And 4, participate in the group discussions and debates around the recommended task force meeting design. I'll be providing some detail beyond what's shown in the slides. The detail is in the notes section of the PDF document version of the presentation, so there's no need for you to write this down yourself. Some of the detail is about Social Security and Medicare, two longstanding social insurance programs. It may be useful reference information for later discussions as the task force discusses potential ways to address issues that may be similar to those issues being faced by Social Security and Medicare. And now slide 4. Here are some definitions for social insurance and public assistance. First, from a well-known dictionary, the definition of social insurance is protection of the individual against economic hazards such as unemployment, old age, or disability, in which the government participates or enforces the participation of employers and affected individuals. Now, from the National Academy of Social Insurance, their definition says social insurance encompasses broad-based systems that help workers and their families pool risk to avoid loss of income due to retirement, death, disability, or unemployment, and to ensure access to health care. Now, this definition is from a US-based organization. There can be programs in other countries that require social insurance participation from individuals other than those who are employed. And now for the definition of public assistance. The dictionary definition: government aid to needy, aged, or disabled persons and to dependent children. And this second definition is the purpose of public assistance is to provide at least a minimum degree of economic security to persons in need. Public assistance programs complement other programs for economic security by supplying basic maintenance to needy persons for whom benefits are not available or are not sufficient. And this second definition is from the Social Security Administration. It's from their Social Security Bulletin dating back to November 1944. Okay. Moving on to slide 5. Examples of social insurance. Okay. First, we'll look at Social Security. Employees and employers pay into a shared fund via payroll tax, and then cash benefits are paid to eligible individuals 65 and older and certain disabled individuals. Almost everybody who's a worker pays into Social Security. Exceptions include certain religious groups, foreign students who are doing part-time work at the university contingent upon their continued enrollment at the university, and foreign government employees. However, if you're a non-resident alien working in the US, even if you're working for a foreign company, you do pay Social Security taxes. The second example is Medicare. Employees and employers pay into a shared fund via payroll tax, and it's also supported by premiums and other taxes. It provides health insurance for eligible individuals age 65 and older, and it covers younger individuals with disabilities and certain qualifying diseases. The first is end-stage renal disease. That requires kidney dialysis and leads to the need for a kidney transplant. The second qualifying disease is amyotrophic lateral sclerosis, ALS, also called Lou Gehrig's disease, and that's a progressive neurodegenerative disease. The third example is state unemployment insurance, and this provides cash benefits to persons who are unemployed, people who are involuntarily unemployed and looking for work. The requirements for eligibility, the payroll tax rates, and the benefit amounts are set at the state level. And these benefit amounts typically are subject to the individual's recent wage history, but they have a very low maximum benefit. In California, the unemployment tax is paid by the employer. It can be up to 6.2%, but it applies only to the first $7,000 of wages. And there's an additional 0.1% tax for employment training. Okay. The fourth example is state disability insurance programs. Only 5 states, California among them, have state mandated disability insurance programs. The other states are Hawaii, New York, New Jersey, and Rhode Island. Cash benefits are paid for individuals unable to work due to illness, injury, pregnancy, or childbirth. And these are funded by payroll taxes and cover most employees. In California, employers who have better disability programs than the California plan, those employees can opt out. In California, the disability income tax rate for 2021 is 1.2% of the first $128,298 of annual employee wages. And the last example is workers' compensation insurance. This provides wage replacement, medical benefits to employees who are injured on the job, as well as vocational rehabilitation. The premiums paid by employers to insurance companies and the rates for that insurance are based on industry and employer experience. Moving now to slide 6, examples of public assistance. Yeah, first we have Medi-Cal, that's California's Medicaid program. Eligibility is subject to income requirements and in some aid categories, asset limits. And it serves low-income individuals, families, seniors, and disabled persons. Eligibility for Medicaid is based on income compared to the federal poverty level. That federal poverty level varies by family size. 100% of the FDL is $26,500 in 2021 for a family of 4 in the 48 contiguous states. Subject to federal guidelines, the states determine the FDL percentages for Medicaid eligibility, and percentages can vary by state and by eligibility group. The second example is the Children's Health Insurance Program, or CHIP, and this provides low-cost health coverage for children. Eligibility is for higher family incomes compared to Medi-Cal. The percentage of the FDL that qualifies for CHIP varies by state and can vary significantly. The third program is Supplemental Security Income, SSI. It's a mean tested program also. and it provides cash payments to disabled children, disabled adults, and individuals 65 and older. The fourth program, Supplemental Nutrition Assistance Program, or SNAP, formerly known as food stamps. That provides nutrition benefits to supplement the food budget of needy families. And it's cash-like benefits for the purchase of food, using an electronic benefit transfer card. The fifth program, Housing Choice Vouchers. These are provided to low-income individuals and families for their rent, or in some instances, for the purchase of a home. And the last program on our slide, Fuel Assistance. This helps eligible individuals and families pay for heating in the wintertime. Okay. And moving on now to slide 7. And just because the government is running and financing a program doesn't make it social insurance or public assistance. Here's some examples. The federal flood insurance and federal crop insurance programs are voluntary, and so they are not public assistance nor social insurance. Then there are benefits who are administered by the government for its current and former employees. So you've got retirement benefits for state, local, and federal employees, including military veterans. You've got medical benefits for the active and retired local, state, federal employees, including active military and veterans. And you've also got to consider that people in these programs, as well as in private industry, that they can receive not only those programs, but also qualify for public assistance and social insurance as well. In particular, sometimes active employees who have large families can qualify for public assistance programs. Yeah, moving on to slide 8. The role of government is similar for social insurance and public assistance. The government administers the program or supervises its administration. Both public assistance and social insurance are based on law. The laws and regulations affect the programs in similar ways, of course, separate laws for each program. So the benefits are established by law and they can be modified by law. Okay. Contrast that with how private insurance works. There, if you have a non-cancelable like disability income policy, for example, that covers you up through age 65, as long as you're paying the premiums on that policy on time, the insurance company can't change the benefit, can't change the policy features, and can't change the premium rate. Okay. You've got other insurance policies that are guaranteed renewable, and there the insurance company is obligated to continue to provide the coverage. An example would be individual long-term care insurance. They're obligated to continue it as long as the policyholder pays the premiums on time. The premium rates, however, may be increased on groups of policyholders, but only after approval by regulators. Individual policyholders cannot be singled out for premium rate increases. Okay. Changes to tax rates on social insurance can be changed. It's rather infrequent, at least recently. Changes to general taxes are driven more than just by the cost of public assistance programs. Those can be affected by other government spending and for economic policy. I would say too that benefit reductions are uncommon in social insurance and in public assistance, either to eligibility or the benefit level, but they do occur. Moving now to slide 9. Talking about eligibility. For social insurance, there's a high level of participation, as we've discussed before. Participation is universal or almost universal, compulsory for a defined population. In some cases, you have contribution levels that are set at such a subsidized rate that the vast majority of those who are eligible choose to participate. No financial need requirements for social insurance. If you're eligible, you can participate even though you have no financial need. The participants have a right to receive the benefits. The payroll contributions provide a legal, moral, and political right, for them to receive the benefits. And these payroll contributions from a given worker can provide eligibility for that worker's spouse or for other family members. Now, the number of claimants for social insurance, particularly Social Security and Medicare, is driven largely by population demographics. For example, Medicare typically comes in at age 65, and Social Security, people can start claiming benefits as early as 62. If economic conditions are such that people are losing their job, then you may find that more people elect to take Social Security at an earlier age when they might have preferred to continue working otherwise. Okay. For public assistance, participation can vary. Enrollment typically increases when economic conditions worsen and may decline after periods of economic improvement, particularly in employment levels and wages. The COVID-19 restrictions in 2020 on business resulted in many people losing their employment, and many of these workers and their employees and their families became eligible for Medi-Cal. For public assistance, financial need is required in order to participate. That's determined by a person's income and or their assets for some aid categories, and they must apply for the benefits. Medical conditions can factor into eligibility. Certain medical conditions may allow for eligibility at higher income levels. For example, pregnant women are eligible in Medi-Cal at higher income levels compared to women who are not pregnant. And because there's financial need required, participants have to show continuing need. There's annual or more frequent redetermination of need that's required to participate in the public assistance programs. Now moving to slide 10, financing. Talk first about social insurance. It has payroll or income-based taxes that are made on behalf of an individual or by the individual themselves. These tax rates, however, don't directly account for the risk profile of the individual participants or their potential benefits. Social Security and Medicare Part A are mainly financed through payroll taxes. Trust funds. These provide explicit accountability of benefit payments and income, and they're generally used when benefits are likely many years into the future compared to contributions. Interest earned on the trust fund is a revenue source for benefits and administrative cost for the plan. Medicare is funded through premiums and taxes, both of which go into the trust funds. Um, Public assistance is funded by general tax revenue. That can be from local, state, or federal taxes. There are some specific taxes that are earmarked for public assistance, and that can be taxes on medical providers and on managed care organizations in the case of Medi-Cal. And for Medi-Cal, the federal government pays a significant portion of total cost for qualifying services. Okay. I'd like to get into some level of detail about Social Security. We call it Social Security, but its formal name is the Old Age and Survivors Insurance and a separate disability insurance program. It's funded through payroll taxes. Currently, employers and employees each pay a 6.2% payroll tax, and self-employed individuals pay the full 12.4% payroll tax. And that payroll tax applies to the first $142,800 of 2021 wages. This wage limit is indexed annually with the Consumer Price Index for urban wage earners and clerical workers. The benefits depend on a person's inflation-adjusted wages over a 35-year period. And this benefit formula is weighted so that Social Security benefits replace a larger portion of wages for persons with lower wages compared to those with higher wages. The benefits also depend on when the individual was born. The normal retirement age, when benefits equal the primary insurance amount, was age 65 for those born in 1937 or prior. But the NRA has been increasing so that it is 67 for someone born in 1960 or later. Benefits also depend on when an individual elects to begin receiving them. That can be as early as age 62, but the monthly amount is reduced from the primary insurance amount for each month before the normal retirement age. And the benefit is increased for each month that benefits are delayed after the normal retirement age, but only up to age 70. Now, a worker's spousal benefit can be as much as 50% of the primary insurance amount. It's also subject to reduction for beginning to receive the benefit before the normal retirement age. Medicare is funded through premiums and taxes that go into the Hospital Insurance Trust Fund and the Supplementary Medical Insurance Trust Fund. Part A, that covers primarily inpatient hospital, is funded by a 1.45% wage tax paid by employees and another 1.45% paid by employers, both parts being paid by the self-employed. And this tax applies to all workers and to wages without limit, although the benefit is the same for all workers who qualify, which generally requires working and paying Medicare taxes for 40 quarters or 10 years. Part A is also funded by income taxes paid on Social Security benefits. And Part A has premiums for people who don't have enough qualifying quarters to be premium free. In 2021, a $471 per month premium is for those with fewer than 30 quarters. A $259 per month premium is for those with 30 to 39 quarters. Medicare Part B, that's mostly non-pharmacy and non-inpatient medical services, is 25% funded by premiums paid by the covered persons. That's irrespective of how long they worked and paid Medicare taxes. And the general federal tax revenue funds the remaining 75%. Part B premiums in 2021 are $148.40 per person per month for those individuals with incomes up to $88,000, or in the case of married couples filing a joint return, $176,000. Premiums increase with income, with the highest premium of $504.90 per month for individuals with incomes of $500,000 or more, or $750,000 for married couples filing a joint tax return. For persons who didn't get Part B when first eligible, their monthly premium may go up 10% for each 12-month period they could have had Part B but didn't sign up. This protects the program from adverse selection of people waiting until they are sick and in need of health care before applying for health insurance. This penalty applies to all their future Part B premiums. Part D, which covers pharmacy drugs, is funded by premiums, which increase with income, similar to the Part B premiums. Like Part B, there's also a penalty for signing up late for Part D, which is determined based on how long the individual went without credible prescription drug coverage. Individuals who sign up for Part B on time without penalty will be subject to the penalty for Part D if they also don't sign up for Part D on time. Medicare doesn't cover all medical cost. There are Medicare supplement policies sold by insurers that cover or partially cover the cost sharing, deductible, and coinsurance in traditional Medicare. And there are Medicare Advantage policies sold by insurers as a replacement to Medicare after receiving funds from CMS. And these often provide lower levels of cost sharing, but generally have more provider network restrictions. And Medicare prescription drug plans are sold separately and may be sold in combination with a Medicare Advantage plan. There is an additional tax of 0.9% on income over $200,000 for an individual or $250,000 for a married couple filing jointly. These dollar limits have been in effect since 2013. They have not been indexed for inflation. And the Medicaid program can pay Medicare premiums for those persons who qualify as eligible for both the Medicare and Medicaid programs, the dual eligibles. Now I'd like to add a word on the federal match for Medi-Cal. For all services that qualify, the federal government pays a portion of the total cost. For Title 19 Medi-Cal, this federal medical assistance percentage, the FMAP, has traditionally been 50% for California and other high-income states. The FMAP formula is used as the state's average per capita income relative to the national average. The highest regular FMAP is by statute 83%, but the highest rate for any state currently is under 80%. FMAP is now higher, an additional 5.6% from January 1st, 2020 through the end of the public health emergency period because of the COVID-19 pandemic. Matching for Title 21 CHIP is at an enhanced FMAP, which traditionally starts at 65% for California and also varies by state based on average per capita income and capping at 85%. It is now 69.34% during the public health emergency. Now, the match rate for the Medicaid expansion for adults started at 100% for 2014 and has graded down to 90% currently. Here's the key point. Federal money pays for more than half of Medi-Cal, so the state is very mindful of changes to the FMAP rates and to the services on which FMAP is paid. And these include long-term care services and supports to those who are eligible for Medi-Cal. Okay. And now to slide 11, some pros and cons about program administration and future benefit changes. Under social insurance, the California State Disability Insurance Program could be leveraged That program already tracks employee payroll taxes. Uh, Assembly Bill 567 contemplates the long-term care insurance program potentially being included as a benefit in the California State Disability Insurance Program, possibly through a nominal payroll tax increase, and structured in the same way as the paid family leave benefits. Under public assistance, there would need to be new eligibility record system created and maintained. I'm presuming that there would need to be some record of years of residence in California, and some level of means testing would be required. This could be similar to Medi-Cal, but at higher income and asset levels. There's a possibility that federal match could be explored through Medi-Cal if expenditures are budget neutral to the federal government's Medicaid budget. But there's a whole list of thorny issues that come with Medicaid, including estate recovery, spousal impoverishment, and asset tests. Okay. Another set of issues relates to benefit levels. With social insurance, modifying benefits is more difficult, especially for those people who are already on claim. This may become a consideration if the long-term care initiatives at the federal level provide benefits that are duplicative of California program LTC benefits. That's not a problem with public assistance since there can be changes in those benefits just made as a matter of law. While it's politically difficult to increase premium rates, this has been done more frequently for social insurance than reducing benefits. And here's some examples from Social Security. Just on the payroll tax that's been charged during the working lifetime of people who are nearing retirement today. The payroll tax increased from 4.95% to 5.05% in 1978, and increased again in 79 and 81 and 82 and 84, and went to 6.06% in 88, and then to 6.2% in 1990, the level it is still today. And as we discussed before, for 2011 and 2012, the employee portion of the tax rate was reduced to 4.2% to stimulate the economy, while the employer tax rate remained at 6.2%. Benefit reductions do occasionally happen with social insurance. With Social Security, the reductions have been much less frequent than premium rate increases. The normal retirement age per 1960 or 1983 amendments was increased from age 65 to 67 on a gradual basis, although the average life expectancy for a 65-year-old increased a whole lot more than just 2 years between the 1935 beginning of Social Security and 1983. But the amendments did not change the earliest age to start receiving Social Security benefits. That remained at age 62. Okay, and now moving to slide 12. We're asking that you fill out the questionnaire about social insurance and public assistance. We will tally the results and distribute them in advance of the next task force meeting. And thank you for listening to this presentation.